So I was charged with talking to you a little bit about adverse childhood experiences, ACEs. And when I was talking to the folks at Ronald McDonald House Charities, I said, we are figuring out an antidote for ACEs. So I'd like to give you the background of what the adverse childhood experiences are. And then I'm going to talk about a new kind of view of what we should do with the ACEs. So the ACEs kind of characterize some kind of tough things that happen to kids in their childhoods. And, after studying that for about 20 years, we wanted to do something about that. So I want to kind of highlight this new idea that's coming up. So next slide. So the ACEs, this has been around since like 1998. It's a really cool study that was done by the Centers for Disease Control and Kaiser Permanente. It was done in San Diego. And it was a really, really transformational project. And I'll show you what they are. Next slide. So these are the ACEs that were in this study, okay? So abuse. So there were questions to these adult folks about their childhoods, and they were asked about physical, emotional, and sexual abuse. And then it talks about neglect, physical and emotional neglect, and then household dysfunction. So people were asked about if anybody in their family had mental illness, if a relative was incarcerated, if their mother was treated violently, if there was substance abuse, and if the parents had broken up. So these are the classic ACEs. So we'll come back to that. Go ahead. So this is 17,000 people who were like in their 50s were asked about their childhoods. Now think about that. The people in their 50s that got this survey, Kaiser Permanente had their medical record. So Kaiser Permanente knew what their health was when they were, let's say, in their late 40s, early 50s. And then the folks were telling us about these ACEs that they'd experienced. And if you know anything about surveys, you know that the response rate is usually pretty low. So like in research, if you do a survey and you get like 30%, you're like, yay. They got like 72, 74% response rate. So people had a story to tell. So these are 40, 50-year-olds. These are the ACEs that they said. So 28% reported physical abuse, 20% reported sexual abuse, 10% emotional abuse, and then the neglect, 14% said they were emotionally neglected. Just about 10% said they were physically neglected. And then look at the household dysfunction. About 26.9, 27% said that there was substance abuse issues in their family, parental divorce, 23%, mental illness, 19%, the mother treated violently, 12%, and then about nearly 5% had a household member. So if you look at that, 36% of those adults, when they reflected on their childhood, had no ACEs. And like these are truly the blessed. Like they had a great childhood. Like I wish I was in that group. So like they had a great childhood. And then 26%, so about a quarter had one ACE, 16% had two ACEs, just about 10% had three ACEs, and then 12% had four or more. So they had a really, really tough childhood. So next slide. So what they tried to then create a correlation with. So like this isn't causality, this is an association. But so they looked at kind of 0 ACEs to 4 ACEs, and then they looked at connections. And again, they had the medical record, so they had the way of figuring this out. So behavior, so lack of physical activity, smoking, alcoholism, drug use, missed work. And then they looked at some physical and mental health issues. So severe obesity, diabetes, depression, suicide attempts, STDs, heart disease, cancer, stroke, COPD, and broken bones. Now, some of these are like hardcore medical diagnoses. Like this is like, like a lot of times, in this kind of work, people say, well, tough childhood, maybe oh my, stroke. I mean, that's like a real finding. So like, so they made a correlation that the more ACEs you have in your childhood, when you're in your 40s and 50s, there's a connection to having these findings. So next slide. So I'll just go through what the formal outcomes were from the study. So next. So persons who had experienced 4 or more ACEs compared to those who had none. So like that 36% who had nothing. Next slide. 4 to 12-fold increase in health risks for alcoholism, drug abuse, depression, and suicide attempts. 2 to 4-fold increase in smoking, poor self-related health, high number of sexual partners, and STDs. And 1.4 to 1.6-fold increase in physical inactivity or severe obesity. Okay? So this is the association. So again, this is really strong science because it was a great survey. They had a really high response rate, and they had the medical record. So the number of the ACEs, so there's a graded relationship. It's like a staircase. The more ACEs you have, the higher risk you have for these really tough outcomes. And some of them are more behaviorally related, and some of them are more kind of physiologic and physically related. Next slide. So, and again, this graded relationship, it wasn't just with depression or alcoholism, because sometimes you can kind of like feasibly think, if you have a tough childhood, maybe you really just kind of have a tough way of looking at the world. But we're looking at ischemic heart disease, cancer, lung disease, skeletal fractures, and liver disease. So that was a real question, like, how did that happen? And then this study, there's actually an effect on your life expectancy. So if you had 6 or more ACEs, now that is a really tough childhood, but if you had 6 or more ACEs, on average, you live 20 years less. So the people that had no ACEs, their life expectancy was 80 years. The people that had 6 or more, their life expectancy was 60 years. So it affects not only like morbidity, the diseases you manifest, but it actually affects your life, like how long you live. Next slide. Okay, so next slide. So child adversity has lifelong consequences. We always kind of clinically knew that what you're exposed to, kind of what you live with in your childhood probably has an impact on your adult life. But it definitely has lifelong consequences. And significant adversity in childhood is strongly associated with unhealthy lifestyles and poor health outcomes decades later. So let me tell you, like I was practicing, in the late 1990s, like when this study came out, word started spreading. Because, in medicine, you tend to go to conferences and you hear. So this was the topic of the year. Like in 1998, 1999, when you were going to a medical conference, these slides were being shown. Like people were like, whoa, what's going on? Okay, next slide. So the CDC, which is a really important organization, they came up with this ACE pyramid. And this was in everybody's slides. So adverse childhood experience. So again, you go from conception to death, right? So your whole life is on the vertical. So adverse childhood experiences leads to social, emotional, and cognitive impairments, which leads to adoption of health risk behaviors, which leads to disease, disability, and social problems, and then early death. And there were these gaps. Like, how did this happen? Like, we always know that it's not good to have a tough childhood, but it actually affects your life and you have a stroke when you're 50. Like what's going on? So there was a lot of work then after 1998 in terms, and there's about 150 papers that were done in the early 2000s, and these are all available in the CDC. Next slide. So, okay, so now let me just take one little thing. So I showed you the ACEs that were in that study, and now there's been a lot of healthcare researchers. So next slide. So these are the ACEs I just told you about, and that's what's in the study, Kaiser Permanente, CDC, 1998. Next slide. So then some people came up with ACEs plus, because there are other bad things that can happen to you in your childhood, and it's not, this list was just the ones that they picked in 1998. So property victimization, having people vandalize your property, steal it, kind of make you feel bad about it. Peer victimization, bullying, exposure to community violence, experiencing poverty, having a significant accident, below average grades consistently, parents always arguing, and no good friends. So that was ACEs plus. And those associations I just showed you, they are related to these as well. And then next slide. Then my colleagues in Philadelphia started to say, there's some things about our population that are somewhat unique. So this study was done in the San Diego suburbs and Kaiser Permanente. So, we're talking about insurance. So Kaiser Permanente is really good insurance. So this was like definitely a suburban population. They said, the people that we're working with in Philadelphia have a little different life. So they came up with the urban ACEs. So experiencing racism and witnessing violence and living in an unsafe neighborhood, living in the foster care system and experiencing bullying, that also has those associations. So my point here is that there's a lot of different ACEs. So we're not just limited to these. And you can kind of see, if you start taking a little bit of an equity lens, kind of having disparities in care, inequities in your life, that actually creates the milieu that creates those effects on your health. So next slide. Okay, so childhood adversity and poor health outcomes. I showed you there's an association. And then there's this black box in the middle. What is that black box? Like, what is it? Like, how is it that, seeing your mom harmed regularly and, being exposed to a really unpredictable environment, how does that affect your life like 4 decades later? Next slide. So the answer's in. So a lot of great science. And the reason why prolonged adversity in the absence of loving and supporting adult relationships in your childhood leads to really bad health outcomes is because the kid is experiencing this thing called toxic stress. And I'll develop that a little bit further. But those scientific gaps that I was showing you on the ACE pyramid, that was the gap, like we've determined. So like when you're living in that kind of environment where you have 4 to 6 ACEs, that creates toxic stress. And I'll define that in a little bit. And that actually affects your brain development. It affects your physiology. And it actually affects how your genetic makeup expresses itself. And there's some really good science on that. So next slide. There is something called positive stress. So, if you just think simplistically, and if you've heard this talk before, I'm sorry, I always like this example because I've experienced it myself. But like when you're like in 3rd grade, that's when you study the solar system. And you always have to do that diorama of now again, maybe the kids nowadays are maybe doing it online, but we had to get a shoebox and we had to make the planets, and then there's a sun. So that was due on Wednesday. And it's now the weekend. And you're like, oh my God, how am I going to get that in? So, you have to be a little stressed to do that. But hopefully, in a really functional family, you have older siblings and your parents, maybe your grandparents, who come up alongside of you and buffer that stress and say, hey, we're going to get through this. Let's get the picture. Let's get the tinfoil. Let's kind of make the rings for Saturn. And they show you that you can get through that. But you need the stress so you get it done, or else then you would just keep procrastinating. So that's positive stress. So there's a really large amount of buffering that happens so that you can get through that. And you learn that there are people in your corner. There are going to be adults that show up and help you get through it. So that's positive stress. Next slide. Then there's tolerable stress. This is a tough situation. Maybe your parents are splitting up and you're worried and you kind of see all the discord and you're at risk. But there are adults that show up and help. So the grandparents start coming. Your parents' best friends start, taking you to ball games with their kids. And you start to see that it's tough, but you're going to somehow get through it. But you're vulnerable because if they don't keep showing up, you're in trouble. And then the last slide. So then the toxic stress, that's where there really aren't people showing up. You're not experiencing that anybody's helping you through this. No one's assuring you that you're going to get through this. So you start to have this milieu where it's really unpredictable in your environment. And when things are unpredictable in your environment, as mammals, we release epinephrine and adrenaline and norepinephrine. And we also release certain steroid hormones that really kind of change our physiology. And then if you're a developing kid, your brain is bathed in that. Day in, day out, you experience this thing. So you're always in fight and flight. You're always in fight or flight. You're always in fight or flight. And that actually can affect neural connections. It can affect how your genetic code expresses itself, and that's called epigenetics, right? So epi means on top of, so epigenetics. So it's not like it changes your DNA, but it actually changes the stuff around the DNA in terms of how your DNA is functioning. So it kind of, it affects what gets manifest. So this is really bad, toxic stress, and this is what we have to address. And towards the end, I'll tell you how we address that. So next slide. So what really changes and what kind of keeps things in the positive or the tolerable is the social emotional buffering. So we have to be about showing the growing child that folks will show up for them. And it doesn't have to be their parent. Now, it would be ideal if it was their parent. But grandparents, trusted friends, people in the community, they just have to know somebody's going to show up. And that actually starts to change that fight or flight, and it then kind of moves them down this way. So all of the programs that Neil was talking about, if you think about them, fundamentally are about having more and more and more buffering. You know, why does Reach Out and Read work? And, you know, Neil has been such an advocate for that program. It's because when you give the kid a book, if they're in a family that is really trying to bring out the child's development, the parent will sit with the kid and page through the book. The kid will sit on the parent's lap and page through the book. They'll start reading it. They'll sound out the words. That creates this buffering. So the person experiences some positive, constructive energy, which then dials down all that adrenaline. Next slide. So these are the things that counter ACEs. So at the community level, so positive environments like the community school, having playgrounds that are safe, having a school where, you know, the people in the school are like interested in your ability and your resilience, not like controlling your behavior, but making a place where you can grow and develop and ask questions and feel at home. And obviously having a home. Next slide. Relationships. So parenting skills. So a lot of the programs teach parents what child development is and how they can do things in their home so that the kid feels that there's support. So the other thing is the parent has to be healthy. So we have to worry about how the mom is doing, how the dad is doing. And if they have mental health issues, are we serving them? If they, if they're stressed about earning an income, are there job opportunities? Is there job training? And then obviously having positive peers. So, bullying is an absolute disaster for a kid because it creates such an unpredictable, difficult environment that they're just always stressed. Next slide. And then at the individual level, teaching kids about self-regulation, breathing techniques. You can get through this. Break a problem down into small pieces. All this social, emotional learning that for some reason, like people are against it. But that's actually what you really need. You have to learn how to get yourself through a tough situation. And then, doing things where kids have a sense of purpose and they contribute to something bigger than themselves and have a sense of self-efficacy. Next slide. So that all goes towards social emotional well-being. And this is kind of the fundamental, this is what counters ACEs. Next slide. Okay, so then just another little diversion. And I always show this thing. So Heckman, Dr. Heckman got a Nobel Prize for economics. And he studied what the rate of return on investment is when you invest in social programs. And he's an economist, right? And he got a Nobel Prize. So he must know something about economics. And the rate of return for the society is enormous if you invest in kids up to 4 or 5 years of age in the preschool. It pays back dividends. As compared to, let's say, post-school, if you're trying to do something for 30-year-old people who are just being released from prison, there's a very low return of rate of investment on that one. So this is why there's so much focus on pre-K and early childhood education, because the Heckman equation says, and this is just consistent, for every dollar you invest in these programs, the society gets about $4 back pretty consistently. The problem is you get that $4 back at the society level, and it's in 20 years. And just about everybody runs annual budgets. So you have to spend, and then 20 years later, you get the money back. So like the only person that can really reap that benefit is the society, and maybe like a forward-thinking governor or something. But like the person who runs the program, they have to spend money. They don't get the money back pretty soon. So this Heckman equation is really transformational. This is really good science. Next slide. Okay, so what's the antidote to ACEs? So we have been ruminating about this for 20 years now. So, and I love it because the antidote for ACEs is hope. So hope is a framework, healthy opportunities for positive experiences. And if I could have the next slide. So, and this is the framework. Positive and negative factors impact child health, and they exist in all the domains of the social ecology. So we have to kind of think there's always going to be the opportunity for positive or negative in a kid's environment. Next slide. Child and parent health and well-being are inextricably linked. So you cannot just want to care about the kid. You have to take care of the kid's parents because the kid lives in a family. So you have to really be interested in 2 or 3 generations. And I would say you should probably worry about their grandparents too. The kid will do well if the parents are doing well. So people that are family, just kid focused, maybe they should worry about the parent as well and not demonize them. Next slide. And then child health incorporates physical, cognitive, social, emotional outcomes. So it's very much an ecological model. So the kid can either have ACEs or HOPE. They live in a family, the family's in a community, and then the community and the family are impacted by policies, as Dr. Avondale was saying. Next slide. So now let me tell you into the science of PCEs. So positive childhood experiences, PCEs. So there's this great study in 2019 in JAMA. Now again, JAMA is a really good journal. So if you get your work in JAMA, it's pretty good. Like it's really hard to get it in there. So in 2019, there was this great study. Next slide. And positive childhood experiences were organized into 4 categories. Next slide. Being in a nurturing, supportive relationship. Next slide. Living, developing, playing, and learning in safe, stable, protective, and equitable environments. Next slide. Having opportunities for constructive social engagement and to develop a sense of connectedness. And then learning social emotional competencies. Now, I know this audience is just eating this up. Like, this is what all of us try to do regularly for the kids and families we're talking about. But there's a framework now. So positive childhood experiences. Next slide. In this study, they asked the people, how often as a child did you experience the following? Next slide, and I'll go through these. Felt able to talk to their family about feelings. Next. Felt their family stood by them during difficult times. Enjoyed participating in community traditions. Now start to think about this. This is countering all that adrenaline, all that lack of predictability. It's just starting to make you feel like somebody cares about you and you have a place in the world. Felt a sense of belonging in high school. Oh. Next slide. Felt supported by friends. Had at least 2 non-parent adults who took genuine interest in them. It's so important for a kid to feel like they're worthy and that like somebody brightens up. So I was at a fundraiser in November, and I don't know how they did this, but they got Oprah Winfrey to like patch in on the video screen. And she was telling us the thing that she thinks changes a kid's life is if they have an experience where when they walk in a room, somebody lights up and thinks that they're worth being there. She said, if you can do that for a kid, they are going to develop well. And I thought she really captured that beautifully. So felt safe and protected by an adult in their home. This is what the positive childhood experiences are categorized. So I told you all that ACE stuff, and you could see how negative and corrosive and terrible those are. Imagine if we could start working on making sure that kids experience some of these. That's the counter. That's the antidote to ACEs. Next slide. Okay, so you remember how I told you with ACEs, there was a dose response related. The more ACEs, the worse your adult health. It's like a staircase. It's true for PCEs. So there's a dose-dependent association between the number of PCEs and the likelihood for adult depression and poor mental health. So if the presence of PCs mitigated the negative health effects of ACEs. Next slide. So among individuals with 4 or more ACEs, so the tough stuff in their childhood, those who reported 6 or 7 PCEs, and I showed you what those were, had a 21% incidence of adult depression or poor mental health. Now compare them, next slide. People who only had 0 to 2 PCEs, they had a 60% incidence of depression or poor mental health. So there's this dose response curve. Like this is really, like, I'm not much of an investigator, but I do know a little bit of science. Like dose response curves are really important, and like it really shows that there's an association that's probably causal. So there's a mitigating effect of the PCEs against ACEs. So all of our programs have to be measured up against the fact, are they creating these positive childhood experiences? Next slide. So our colleague, Bob Sagi, who's at Tufts University in Boston, he's come up with this hope framework where he takes the PCE science and he says, let's start developing programs so that we can counter ACEs, because we've got to get about doing that. Next slide. So the framework promotes a relationship-based, and we heard a lot today about trust and honesty and being connected, a relationship-based approach which transforms interactions between the providers and parents, opening up dialogue to focus on families' assets and strength. And if we go to that, just go back one. If we go back to that first bullet, this hope framework, it really is trying to honor the family and the dignity of that kid, and the fact that the family and the adults in that kid's environment probably want to do the right thing for the kid. But they might need some help. They might need some support. They might need some encouragement. They might have mental health problems themselves. They probably had ACEs when they were little, and now they're a parent. So rather than demonize people and tell people what deficits they have, we have to be about kind of putting all that support there in an encouraging, respectful way. Keep going. We'll go to the next slide. Next slide. So this hope thing is built on 4 building blocks. There's a lot of attention on relationships. There's a lot of attention on the kid's environment and having a safe and equitable environment. This notion of safe, stable, nurturing environments that Dr. Davis was talking about. The reason why that works, when they said that, they didn't have the positive childhood experiences data. But the reason why that works is that it counters all that adrenaline and the steroids that are kind of raising the brain. And then this notion of social and civic engagement. Like, it's really important for a kid to feel that their culture is being honored, that they can go to a parade and see people that look like them being honored. Like, that's really like part of our wiring. And kids know if their parents are being disrespected. They know that. They have sensors that pick up on that. And, people were saying, well, what could we do? Well, first of all, let's have a professional environment that we greet everybody and treat them with honor and respect. Because the kid notices how we're talking to the parent. And if when they come for their visit, they see that we, frankly, could care less who the parent is, the kid picks that up, and then they know that they're not as valuable because their parents aren't as valuable. And then this emotional growth. Really, kids being able to play and interact in a healthy environment. So, like, organized sports are really important because kids, develop all the positives of athletics. And if they're not athletic, that's okay because, being on the marching band is great. And if they like something else, that's great. And the chess club is good too. But they have to be able to kind of feel like they can have recreation. Next slide. And then this is just more, detail. And I just have this up there to tell you, if you really get into this work, Bob Sagi, his center, he's published on this. And he has all sorts of toolboxes, and you can get trainings, and there's a Hope Conference. But this is kind of some real granular stuff in terms of how you can start doing these building blocks. Next slide. Okay, so then I'm just going to close with the Nurse Family Partnership, which is one of my most favorite programs on earth, because this started at least 30 years ago, before we were even talking about positive childhood experiences, hope, this was just like, he was really, David Olds, who designed it, actually was just trying to get his PhD. So he designed this great program, but he did a randomized clinical trial to show that if you connect a young first-time mom with a registered nurse who visits that young first-time mom for 2 years, something magical happens. And, we had all those scientific gaps. We didn't know what the magic was, but we knew something happens. Next slide. So it's evidence-based. It's had 3 randomized clinical trials. So again, you don't have to be an investigator to know that if you do a randomized clinical trial, you do a lot of good science, particularly if you find a finding that's statistically significant. And if you keep repeating the finding 3 times, it's probably actually happening in life. So partners the first-time mom with a registered nurse. And it's, in his model, it's really important that it's a registered nurse. Next slide. Has been proved to dramatically reduce the rates of child abuse, arrest in youth under 15, and the frequency of emergency room visits. And the reason why that is that the family learns a lot about child development, so they keep the environment safer. So every dollar invested in nurse-family partnership saves up to 5. So that Heckman equation, this is one of the data points for that. And that's been consistent. Next slide. So this is just a little bit more about, there's better, a lot of times the nurse visitor is connected to the mom before she delivers. So there's less prematurity. There's more child development, better immunization rates, school readiness. One of the cool things is it changes the mom's life course as well. So she spaces out the next pregnancy. She tends to pick less violent partners. She tends to go for job training. She actually gets a better job eventually. And she actually pays more taxes. Next slide. So the reason why this program works, at least in the nurse family part, and there's other family visiting programs. We heard Parents as Teachers, that's another great one. It's evidence-based. There's Healthy Families America. I'm on the board of Prevent Child Abuse America. That's theirs. And they don't use nurses. So all the evidence-based all the evidence-based home visiting programs work. And some have just a stronger dosing effect. So for young first-time moms, using a nurse is really important. If you hit the next slide, this is why. So first of all, nurses are very well trained. There's a high level of trust with nursing. If you ever look at the Gallup survey, the people that have the worst respect in the society are U.S. congressmen. And the highest rated profession is a registered nurse. So nurses are really well respected. One of the things is they have a lot of credibility and perceived authority. And one of the cool things about using a nurse in a community, particularly one that has a lot of poverty, is that the nurse is usually viewed as a very successful woman. And this very successful woman comes into this young first-time mom's life and really starts to become a role model. And, she has her act together. She's got a job. She's mentoring. And now if you start thinking about it, she's really creating positive experiences for the young first-time mom because somebody's showing up for her. So that's kind of why this thing works. And then, of course, nursing itself does have a lot of theory and practice around how to do child development. Next slide. So, and then just keep going. There's just some real good science behind nurse-family partnership. I wanted to leave time for our discussion. So next slide. And then there's monetary benefits. Again, it pays back $5 for every dollar, but it pays back that in 18 years. So it's not going to be like you're going to get the money next year. And then there is some science behind it. Next slide. And then this is the last slide. So this was from USA Today. So if you want to invest societal resources where they will have the biggest benefit for all of us, clearly the evidence is there now that protecting children from the worst kinds of deprivation in their youngest years will result in more functional, capable, pro-social citizens. And this has just been consistently shown in those 3 randomized clinical trials. All the other home visiting programs that are covered in that MIC-V program, there's dollars from the federal government, and states have these, and Utah has some of those dollars as well. And Neil's involved in one of the nurse-family partnerships. They all provide that hope. And that's the point. So, people said, what can we do? We should make sure that our political leaders know that we want these early child development programs. And I think, some of the comments that Aaron was making earlier, there really are bipartisan coalitions that come together around this. So, one of the things I would just say to folks is we have to be about getting our politicians to support these programs. And that means we may have to work with some politicians that on some other issues, we really don't like them, but we should not demonize them, because if you demonize them in front of the cameras, they will not be open to this conversation. So we we have to be somewhat wise here. This is where the money is. If we could get these programs more fully funded and get them really in our community, there are going to be hundreds and thousands and tens of thousands of kids that don't have those awful ACE effects. It's going to be the PCE effects. And that has to be what we kind of unify on. So with that, I'll leave it to some questions.
Thank you so much for all that amazing information. My name is Maria, and I own a nonprofit called the Sammy Center. For many reasons, I started the school, but mainly because of this. We're a very, very small program. That's one of the big things, is that we're high quality. We have 10 to 15 children that have experienced high ACEs. My question for you is, as the director and the founder of the school, I spend most of my time trying to lobby, trying to talk to legislators, trying to educate people on the importance of this. That if we can help these children at a young age, we'll see less what you're talking about in their 20s and 30s and 40s and all of that. And I'm getting out there. I'm getting in front of legislators. I'm doing what I can. Representatives. I'm at the Capitol all the time. Can you speak more to that? Because you closed with that and you said we need to get with the politicians. Can you just say more about that? What more can we do?
So I think some of what we need to do at a policy level is really get connected as a community that wants to put this good information in front of all the different types of legislators and all the different regulators, and make sure that whatever our credibility is, we use it wisely and we present the evidence and really get them behind this. And I think the fact that this has some economic information is really helpful. But I think we do this better together. So like the American Academy of Pediatrics Utah chapter, Voices for Utah Children's, your organization, I think we should really keep working together, because we have to be absolutely relentless so that there's no way they can walk away from this, because this is the answer for a lot of the problems that we see with people in their 20s and 30s. So if you want to empty out the jails, you would really do wise to invest 20 years earlier in this. And that's what Heckman told us. If you want to really deal with, the violence that we're seeing, you would do this. Like if you look at some of these tragedies that happen with school shootings, the people that did the school shootings did not have many positive childhood experiences. So this is kind of the answer. So I think we have to actually unify around having a pretty clear message. This is what we should be about for the next 10 years. Like we should get these programs funded. It should almost be impossible for you not to bump into one of these programs.
Yeah. So that is the biggest issue with my program, is getting it funded. I have families that need to be here. I have 10 children that have been expelled from preschool. They are 3, 4, and 5 years old, and they've been expelled. And the families, because of their situations, can't afford my program. How do I pay my teachers that are high quality, master's level teachers, if I don't have the funding? So we do need to come together.
Yeah, we need to come together for a couple reasons. One, we have to get the legislators to pump a lot of money into it. And Medicaid is one of the programs that could pay for this. But the other thing, too, is by working together, sometimes some of the other groups have some resources. And then you'll have a network of people that you might be able to say, look, this kid needs it. So somebody better come up with the money, or else we're going to have a school shooting in 15 years. Yeah. So, but we need our friends. We need our friends.
We have another question.
Yeah, go ahead.
Or comment.
I think it's just a quick question. I love the ACEs study. I think it gives us leverage
it gives us actionable items. My question, it's always stood out to me that death of a parent and a sibling isn't listed as an ACE. And I'm wondering if you have any insight into why that why that was missed. To me, that feels like it's definitely an ACE.
Yeah, and I think it probably just when they were coming up with the list of things that they were going to put on there. But that would absolutely, and again, that one slide where I was telling you about the ACEs plus and the urban ACEs. I agree with you. Again, what we know about ACEs is that the list is less important than how destructive it is. Now, I will say sometimes when there is a death of a parent or the death of a sibling, there actually are other people in the family that are supportive of the kid. So it may very well be that some of those ACEs in certain families have some mitigating factors. So I just, so it might have been when they were picking the list, they just didn't see a strong enough effect.
And I think we're all aware there's also a bit of brokenness that happens in a family, and so often parents aren't as nurturing during that grief period. Yeah. So I probably, because I work here, it's always stood out that that's not included because it is so impactful.
But that's why, there's really good groups around bereavement services. So like bereavement services should always be funded and supported for that specific reason, because sometimes the family members are hurt themselves. So that you notice in the positive childhood experiences, 2 other adults in the family, in the kid's environment show up for them. So that might be part of that. So, but I would just argue for really good bereavement services because the whole unit needs some help. So I guess, as you're finding another, I am trying to be really optimistic and hopeful. And I know we're in a really tough spot in the country right now. Like it just seems like being mean-spirited and saying awful things in the press is like what politicians are trying to do. That fever is going to break at some point. So I think we just have to, the people in this room are just such good people. I think we have to keep showing up and saying that behavior is not acceptable, but we shouldn't do that behavior to them. Like we should not model being mean-spirited back to them. Although we could really give some zingers because some of the things they say, they deserve to be called on. But I think we have to kind of model the other way because we've got to get everybody through this. So I would my plea to everybody is don't contribute to the polarization because that's going to go down a bad road. I think we have to keep saying enough's enough. Stop with the name calling. Stop making fun of people. Stop demonizing people that look different than you, that talk different than you, care about people of a different sex that you could just stop. So I think we have to just keep doing that.